Hello and welcome to Health Business. My name is Oluwatoyin Kolawole. On this program, we educate you on how to live healthy and stay healthy. First on the program this morning, we take you on a trip around the world of news. Stay tuned.
The Lagos chapter of the Association of Community Pharmacists of Nigeria, ACPN, has called on the federal government to begin the implementation of the National Drug Distribution Guideline without any further postponement, saying prompt implementation will help tackle the chaotic drug distribution that is rampant in the country and safeguard the health of the nation. The chairman of the association, Biola Paul Ozier, made the appeal during the 2017 Community Pharmacist Day, which was part of the program for this year's Pharmacy Week, held recently by the Association of Community Pharmacists of Nigeria, Lagos State Chapter in Ikorodu, Lagos.
This year, our theme is Building a Healthy Nation, the role of community pharmacists. We want to examine how community pharmacists contribute to the building of a healthy nation. Now we know that health is wealth. When the people are not healthy, there is no way they can create wealth. It's when they are healthy, it is when they are lively, it's when they are strong that they can go out there and work and then contribute to the GDP. It's then they can contribute to the national treasury, national development, national growth of the federal government.
High point of the event was the free counseling and screening on HIV, blood sugar, blood pressure, breast cancer, cervical cancer, prostate cancer, dental check, and tuberculosis offered to the people of Ikorodu community and its environs. The National Malaria Elimination Program has urged the media to collaborate with it on malaria control, care, and prevention in Nigeria. According to the organization, collaboration with Health Writers Association of Nigeria would help to achieve the program's strategic plan of ensuring total elimination of malaria in Nigeria by 2020. The national coordinator of NMEP, Dr. Audu Mohammed, made the call recently during a media chat on malaria organized by EWAN Lagos chapter in collaboration with the body. The theme of the media parley is management of malaria in pregnancy. The United States Agency for International Development, USAID, and the Nigerian Ministry of Health have inaugurated a medical facility that will provide medical authorities better access to life-saving medicines and other essential health commodities. USAID, in a press statement issued in Abuja, noted that the Premier Medical Warehouse Facility, also known as Warehouse in a Box, is constructed in partnership with Nigeria's Ministry of Health and Global Fund to fight AIDS, tuberculosis, and malaria. The new state-of-the-art medical storage facility cost $5.1 million. The U.S. President's Emergency Plan for AIDS Relief, PEPFAR, through USAID and the Global Fund with the Nigerian Ministry of Health approval, provided support for the construction of the warehouses in Abuja and Lagos.
Welcome back. Recently, a 14-year-old girl was raped to death in Lagos by some unidentified people right in her bedroom. This story caught the attention of many print medias and even broadcast media in Nigeria. Some other cases of rape happens in Lagos and in Nigeria would have been reported by the media. How can we curb this trend of rape in Nigeria? How can we nip it in the bud? How can we eradicate it totally in this country? To discuss this issue with me this morning is a child rights advocate, a lawyer, and a founder of Chichiyara Foundation in Lagos, Mrs. Bola Tinubu. You are welcome on the program.
Thank you so much, Joy.
Rape cases in Nigeria, why is it on the rise now?
Well, what's happening is that you're seeing more reports of it in the media. There has always been sexual abuse in our country and all over the world. for many, many, many years. But it's caught the attention of advocates around the world and now in Nigeria. So there are more people talking about it. Some state governments are taking a proactive position on this and doing something to bring awareness and attention to try and prevent the rising cases of child sexual abuse.
So how can we curb this trend?
So if we take this extremely unfortunate tragedy that has just happened, there are many issues that we look at. First of all, you see a young girl, a child, who tried to protect herself in the face of advances from the opposite sex, older youth. This in itself is child sexual abuse. She tried in her own way. She did everything a girl would normally do. She told her mother, she fended them off physically on her way to and from school. But she didn't know where to go. Her mother didn't know where to go once they had done that. What information do we have out there to tell people, tell children, that there's help here? If you are in trouble, this type of trouble, this is where you go to.
So moving on now, what do you think, at what age do you think parents should start educating their child, or their boy or their girl, on the issue of rape?
Now, you need to start teaching children about body safety and boundaries from as early as they can walk almost. It's not out of place to tell a toddler that these areas of your body are private. And that you own your body and no one else should be able to touch them. That's where it starts. And then as the child grows on, you use more appropriate developmental language to teach them about the dangers of sexual abuse.
As a lawyer and a child rights advocate, what should be the judgment for rapists?
Right now, we actually have pretty adequate laws in most of Nigeria, and that's in the south. It's life imprisonment, and life imprisonment is life imprisonment. They should be locked away for life, and that is adequate. The problem is not in the laws that we have, it's in the enforcement, and that is where we need the communities to come together to realize that it's not just the police, the job of the police or the job of the judiciary. We have to get people to report, and in order for us to get children and families to report, they have to have some kind of confidence in the judicial system. What kind of confidence are we giving them when, as at today, less than 1% of cases of rape will end up in a conviction? That doesn't augur well for any child or parent to want to enter the system to try and get justice or hold a perpetrator accountable. So we need to start from the bottom. We need to ensure that cases are properly investigated thoroughly so we can get more and more convictions. When families begin to see this, they'll have more faith. They'll come out, they'll report because they know they'll be treated fairly. The children will be treated with respect and empathy, and they'll be supported throughout the process. And this is what we're advocating for.
Okay, lastly on the program, will you agree with me that indecent dressing is the major cause of rape in Nigeria? Because I belong to a group of journalists, and they argue almost every time that women are the cause of rape. What is your take on this?
I think you have answered the question. The dressing has absolutely nothing to do with it. What this is about is a society that doesn't value its children enough and allows this to go on continuously and turning a blind eye. That is the problem, not issues that are raised of dressing or indecent dressing.
Well, it has been so nice having you on the program this morning.
Thank you.
Thank you so much, ma'am.
Thanks very much for having me.
Well, that has been Mrs. Bola Tinubu educating us on how to nip rape cases in the bud, how to reduce the trend, and how parents should educate their wards on the issue of rape. The program continues in a minute. Next on the program is the pharmacy segment. Stay tuned.
It is an eyesore when one walks into a typical Nigerian market and sees drugs sold openly, like common merchandise such as clothes and cosmetics. This attitude portrays an acute lack of understanding of the nature of drugs and the obvious fact that those peddling them are not professionals who are authorized to handle such sensitive products. But the practice has continued to thrive, nevertheless aided in part by the patronage of the public who have indirectly continued to sustain the practice. The practice of selling drugs in the open market has not only affected the general efficacy of drugs by exposing them to extreme temperatures that make them expire early, but has also provided avenue for counterfeits to be produced and sold to an unsuspecting public away from the eyes of regulatory agencies like NAFDAC. What is the position of the Pharmaceutical Society of Nigeria on this issue?
Medicines or drugs, whatever you choose to call them, are not ordinary articles or commodities. They are specialized commodities. That is why most responsible countries place regulation of medicine use within the confines of a central government, of the equivalent of what you call the federal government in Nigeria. In Nigeria today, we have a Fake Drug Act. The Fake Drug Act is very clear in Section 2.1 that the sales of medicines, the sales of drugs is prohibited in some places in Nigeria. One of such places is what you just talked about, hawking. It is actually an offense for anybody to hawk drugs in Nigeria.
People now take medicines that fail to cure their ailments because the active ingredients have been lost to poor handling, or counterfeit drugs that have been sold to them because they sourced for their medicines from unauthorized outlets.
If you hawk drugs, it's a matter of common sense that in a tropical environment like we have in Nigeria, what you're doing is that you're exposing the medicine to extremes of temperature. Ordinarily, you have a range of medicines that should be stored at about a range of about 5-8 degrees centigrade. Vaccines, biologicals, insulin preparations, things like that. And then you have another range that ideally should be kept at a temperature of about 8 to 15 degrees centigrade. Now, if you begin to hawk medicines, what you're doing is exposing them to the direct rays of sunlight. And that temperature range will give you something like 25 to some extremes that can get to 35 degrees centigrade, even higher than that in the northern part of this country. And so what you will get is what we call in pharmaceutical parlance accelerated degeneration.
Nigerians also share their own views on the dangers of drug hawking.
So many people take drugs without the prescription of a doctor, and sometimes at the end of the day it causes death and more disease to them. I think that the government should stop it so that it will help our society to grow better.
They don't work with prescription, and most of them you find out that they are not even inclined with anything that has to do with drugs. So they just get them, sell it anyhow they want to, no dose, and really is affecting our community seriously.
Those are fake drugs. They're actually fake drugs, and it's not good for human health. So I think government should abolish such things in the country.
The latest report by the Pharmaceutical Society of Nigeria reveals that sale of drugs in the open places like motor parks, open drug markets have led to fatalities and various forms of injuries to the health of the public.
It's now time to join Dr. Abayomi Ajayi on understanding infertility.
Hello, you're welcome to Understanding Infertility with Dr. Abayomi Ajayi. Now the next question to ask is, how do we treat infertility? I think this is the million-dollar question. Well, we can look at this from three main points. We can talk about drugs to treat infertility, we can talk about surgery, and then we can talk about assisted conception. When we're talking about drugs, we can look at it from the male and then the female. I'm sorry to say that in men, drugs have very little impact in infertility. One thing I want to say is that there is no drug sperm booster as of 2016. For drugs in the woman, yes, when the problem alone is that the woman cannot ovulate, then drugs can be of tremendous help here. Of course, we can use tablets, and then there are injectable drugs for ovulation induction. And then surgery. This used to be the cornerstone of treatment before, but we now know that the success rate of surgery for men and women with infertility is abysmal. For the man, we talk about varicocelectomy. Well, that's something that nobody can really swear by. Sometimes you get some results, sometimes you don't get any results. So this is not consistent. And so many studies have been done that shows that the sperm parameters improve for some time and then it comes down. But really the function is not in any way improved. Now, for the woman, we used to do a lot of tubal surgeries, but we now know that tubal surgeries and infertility is seriously, the success rate is in the neighborhood of 5 to 10% from all studies that have been done all over Nigeria. And therefore, yes, there is room for tubal surgery, but in very selected patients. These are patients that you have done laparoscopy for, and you can see that the only thing that you need to do is just probably get rid of some flimsy additions, or scar tissue, which we can then do. But majority of the patients will benefit from assisted conception. Now, we can look at assisted conception and say that there are procedures that aid or increase the chance of conception per cycle of treatment. Now, that is, for the cycle in which you're applying the method, then there is increased chance of getting pregnant. The three categories of assisted conception comes from how complex they are. For me, let me say that for you, for a particular procedure to qualify to be called assisted conception, it must have three characteristics. The first one is that you must use drugs to produce more than the normal one egg that a woman produces every month. There must be a method to bring the two of them, the egg and the sperm, together. And then there must be also a method of sperm preparation. So the egg, you prepare the egg, you prepare the sperm, and there must be a method of bringing them together. Depending on how complex this method of bringing them together, that's when we talk about whether it's intrauterine insemination, in which is the most basic way of bringing them together, in which the fertilization still takes place in the tube, to IVF, in which you bring the sperm and the egg together in a tube, or to ICSI, which is like the zenith, where we call manipulation, in which you actually inject a sperm into an egg. All this we're going to take in subsequent episodes of this program. So just join us every week, and definitely before, in a number of weeks, you almost know as much as a doctor who is specialized in reproductive endocrinology. There are support groups all over the place, and we're going to introduce you to one of them in the course of this program. And of course, we expect IVF clinics also to have qualified counselors that can help you as you go along this journey. Always remember, together we can conquer infertility. My name is Dr. Abayomi Ajayi. Catch you.
That's our package on health business today. Join me again next time on same station. My name is Oluwatoyin Kolawole. Remember, living healthy is a serious business. Bye for now. Thank you.